You want a motion? Do I have a section over there? Well, just keep working it.
Yeah, we can do whatever. The look that I gave you was, how do I go and explain this to the people that were there? They're gonna want their explanation. That's the look. I go past it really fast.
Yeah, I dug her office already, goes, oh, I know the elders and I did. Hi, how are you?
Thanks. That sounded like it was over there.
Tom, are you part of the discussion and the solution on the 29th in Grove? I got the information that you were part of it. Is that right? I think I'm part of it, yeah. You have been? Okay, all right. You're happy with whether Willfully, no, I'm not asking any questions. Meeting is next week, right? Yeah. I agree, there was nothing telling them. But yes.
Now it's 1 o'clock by that clock, which I'm going to say is the official clock, not the one that's on the wall. That says it's 1 o'clock, and we do have a quorum with Mary and Senator Reddy on the Zoom, and those of us that are in the room. So I'll call the meeting to order. My name's Scott Bruner. I'm the Deputy Secretary for Hospitals and Facilities at KDADS and chair of the panel. Thanks for getting together today. Our main items of business are to try to finalize our final report that's required by the executive order. It's due at the end of September, so we've got a couple more weeks to work on it, but this is our last opportunity or our last time that we've got scheduled to meet. So we'll spend, and then we've got a few updates from other parts of the project team, and Claudio asked to have a few minutes as well to talk about an issue he wanted to raise. So that's our agenda for today. I'll move on to approval. Well, are there any other agenda items that anyone else from the panel has that we want to add to make sure we don't forget? Anything? The minutes were circulated prior to the meeting from our August 16th meeting. Any corrections or additions, deletions in the minutes? Please. Nope. Motion would be appropriate. Motion to adopt, and a second from Tom Stoltz. Any other discussion or other changes in the minutes? Hearing none, we'll consider the minutes adopted. We'll move on to project updates. Tanya just texted me and said she wasn't feeling very well, so she's not here to do an update. So well, maybe I'll do hers first because she texted it to me, so I can provide hers, and then I'll do a brief update. Tanya's update from the county was that we've closed on the property on the site. We've obtained the title documents. So that's all. The property acquisition is complete. We're still on the timeline for construction. I'll talk a little bit more about that in just a second. The county is hiring an outside law firm with some construction experience to work on the bidding process and the award process. And so that'll be part of the bidding package and the discussion around the acquiring a general contractor. We move into the fall. Maybe stop there and see if anybody else, or anybody else from the county, have any other updates. Thanks for the commission's work and the staff's here's work to get the property closed on. That's a huge step in the project. Just for me from the state side, we're continuing to work on design and with the architects on the construction documents, kind of getting into some of the detailed areas around plumbing operations, low voltage electrical for the security and internal control systems. Floor plan largely resolved. We did go through a pretty extensive discussion about the security of the building overall, and in particular the loading dock on the front side of the building and how that would be secured. Talking about the flow of patients into the building, staff into the building, making sure people don't leave when they're not supposed to leave, some of those kind of ins and outs. So a couple of those things have required some alterations in the design, but nothing that's significant, and it isn't slowing down the progress. So I believe I'm a little fuzzier on the timeline for the bidding documents to be completed and awarded, but at a high level, and maybe we can talk about this more in October. But so I think the schedule is to have the construction documents complete by the middle of October, I believe is the timeline, put out for bid with responses due in November, and then with an award decision to the general contractor by the end of December. But there'll be some steps along the way in the county's process that'll take us through December. So
think at our November meeting, or certainly by the December meeting, we'll have a better idea of who's on the table for that, what's in that bid package. Well, certainly have idea what's in the bid package, but kind of as we're progressing through the award process towards the end of the year, and then with the goal to have the construction contractor awarded by the end of December, or the county commission's last meeting in December, and then ready to go with breaking ground and starting construction in 2026. I asked Basil from Pulse if they had any updates, and they would rather have spent the hour working on the construction documents, which I thought was a fair fair request. So they're not on the call today, but are there any questions from the panel? Or Irina, do you have any updates from the project team that you'd want to provide?
Good afternoon. It's moving along, and I think we have made a pretty good progress, both overall and on some more detailed pieces. So I think everything will be timely. That's my hope. But certainly we are working very closely with our experts on OSH and LSH team to get as much input as possible on how to make it the best that we can.
Thank you. I can't remember either in the minutes or at our last meeting. I hope I announced. If I didn't, I'll do it twice. So Irina Yermenko, who just spoke, we've appointed as the acting superintendent for the building. She's been involved in the project from the beginning. The secretary and I thought we needed a real, not just a figurehead, but a locus of control for the project. And Irina's got a lot of experience that's relevant to the project, the starting of operations and moving forward. So she's been on board now in that role for a little over a month, and doing very well. And we're trying to replace her role as part of our team, so she can focus on the project entirely. So I'll probably have her do the project updates going forward and get me out of the middle of year enough for me as it probably is. But any other questions from the panel members about updates on the project or issues you want us to raise at future meetings? Anything?
Scott, are there going to be any other public forums coming up as the project proceeds?
We haven't scheduled anything. That's a great question. We have talked about it with our Greenbush partners about what the right time would be to do that. And I probably need to get some guidance from Tanya and the team here at the county about what would be helpful in the bidding process and what would interfere more with the bidding process. I'm more worried about the interference part. So I think maybe as we get to the end of the year or the first or into January, that might be the right time as we have a construction contractor awarded, the design's all complete. We'll have more renderings, more things to look at and show the public. That might be the more appropriate time before we break ground. But if there are other thoughts about opportunities that was number one. Number two, we have talked with Greenbush about setting up an advisory like a citizens advisory panel for this hospital. We have those at Larned and Osawatomie as well. So we've been looking through our list of people who've asked to be involved in the project or be updated about the project and the membership of the group at the other hospitals to see, can we take our list of Monica and Ryan, the 200 or so people that have said, please keep me informed, and winnow that down to a reasonable number that might be an advisory group that we could pull together. That's not completely a public process, but at least another step towards kind of having a way to get information out to the public as well. But I think formally, in terms of a public meeting, it'd probably be the first of the year before we'd be ready to do something that wouldn't interfere with the bidding process. Other project update questions? Okay, I was going to talk about kind of the budget that we've proposed or submitted in the process, but Claudio asked for a few minutes as well, so I'll turn the mic over to him for his issue.
Yeah, thanks, Scott. I just wanted to give the panel sort of a snapshot of the state of psychiatry as we find ourselves in at this point, as our own ED expansion moves forward, as our own, obviously the psychiatry, the state hospital is project moves along. But just to give you a little bit of flavor of how we are covered over at Ascension Via Christi St. Joe, we have 3 groups of providers that all have some role in the care of the patients. We have our own employed group. It's called Ascension Medical Group, and we employ 5 or 6 advanced providers as well as 4 MD psychiatrists. We also obviously utilize the providers of ComCare and then the faculty and residents of KU that provide the basic coverage for our organization. Probably over the last 6 months, we had one of our 4 Ascension Medical Group psychiatrists resigned, gave notice, and has left the market. He was also married to another psychiatrist who was on the faculty of KU. And she was providing a lot of the inpatient coverage over at St. Francis if there was a medical patient with a psychiatric condition. And so she was covering St. Joe. So with the departure of those 2, it created a void. We have been able, so that left 3 psychiatrists on the Ascension Medical Group side. We have been able to bolster that with Clear QLER. That's our telepsychiatry service, which has done an amazing job, by the way. That primarily, we utilize it in the ER for consults at St. Joe. And it also is being used for consults and inpatient consults at St. Teresa and St. Francis. And its disposition to non-inpatient admission is quite higher than one would expect. So we are seeing a larger discharge rate to either home or some community service with wraparound services around the patient, which has been amazing work in our emergency rooms. We used to typically board 20, 25. This whole week we boarded 6, 7, which is, yeah. So we're making strides on that side from a throughput standpoint. So the 3rd resigned, or the one resigned, and now we're given notice from another one of the Ascension Medical Group. And they see about 60 to 80 patients, 75 patients at St. Joe. So it's a service that sees a lot of our patients. This one will be departing in December. So Ascension Medical Group is actively recruiting to fill that void. And so we had a subsequent meeting with Tom and Tim, a few of our physicians and KU as well, just to sort of keep people alerted to this could easily slide down a really bad spot during this gap, because it's very difficult to recruit psychiatrists. But we wanted to alert them about that. Dr. Antonio's helped put that together on our side. We're just keeping the story going to make sure that everybody's informed as we put a lot of resources into this space. We got to think about today too. And that's really the intent of bringing this to the forefront. And subsequent to that meeting, Tim and Tom probably organized a meeting with the Behavioral Health Center of Excellence team and actually have some ideas about throwing some resources at it to, again, help shore it up. But I just wanted the group to know we were 4, we're going down to 2. We might be able to hold on to the 3rd for a little while longer to help in our partial day program for a little while longer. And then we have in the process of getting another provider on a part-time basis, again, to shore it up. So there's a lot of shuffling going on to try to provide this at least inpatient coverage as we speak. But Clear has been a big shot in the arm, and we're really squarely focused on this. We're continuing to tell that story legislatively, city, county, and also we have had some advocacy sessions. KHA held one over at the Kansas Leadership Center that we attended and had some good FaceTime with those that attended that particular session. Tom, would you add anything?
Claudia did a good job of describing it. As we go down this path and we're looking at behavioral health as a system, it's concerning at the doctor level, at the MD level, the psychiatry level, but it stems all the way through to nursing, to clinicians, et cetera. It's just a challenge. So it's good that we're looking at workforce with this group. I think this group is engaged in not just the psych hospital, but the system in the state of Kansas. We have a couple of engaged legislators on. So I just thought it was important, and I'm glad Claudio brought it up, just to show you the challenge we have over the next 3 years for sure, to get us to the stopgap and keep these positions staffed appropriately. So.
Senator Reddy, your hand is up.
Yes, thank you, Scott. And thank you for the update on the psychiatrists. So I don't know, you may have mentioned it and I may have missed it. What was the reason for the departure? Was it, I don't know. I don't want to assume anything.
Yeah, the original two, it was Dr. Matone. I forgot his wife's name, but they wanted to be closer to family in California. So they moved to Sacramento. And the third one, the one that's recently tendered her 90-day notice, it's burnout.
Okay.
It strictly is burnout. I mean, like I said, between the three of them, they're probably seeing 30 plus patients per day. When there's two of them, it goes north, and so the quality of care, we're really get challenged and concerned about that when you're seeing those types of levels. So burnout's going to be a big challenge that we're going to need to overcome, and losing one more will really be a crisis. So we are concerned about that. That's why we're trying to bolster the main two with others, having conversations with KU and others to see about how can we all step up to spread the load. And we've got a nice response from the KU team, and so we'll just keep everybody up to date. But we are actively recruiting, and we're also investigating possibly some outsource opportunities to bring more resources from outside of the state to sort of outsource. Like we have a ER physician group called Vituity, something like that. We have, a hospitalist group called Sound. They're national. We might look at a solution like that in this space, just because, again, they can shuffle providers from other locations and probably have greater ability to recruit on a bigger scale. So again, those are all in play.
Okay, thank you. I appreciate the information. So it's probably not so much salary, but just the burnout of too many patients with too few staff. And if you have ideas for legislation, please let us know what's working in other communities or other states. I understand we can outsource and contract out. I think telehealth is a great idea, but having boots on the ground and helping each other out with that kind of staffing. We have lots of ideas and lots of legislative pieces moving forth right now, but if you think of any other way we can assist, we would be open to more ideas. Thank you.
I think those recommendations made by within as part of our recommendations, there's a lot of activity around resourcing talent across the continuum. And I think if the legislature supports that whole body of recommendations, I think that's a great start, and it keeps telling the story.
Okay, thank you.
Questions or?
Scott, as you may know, we had a little bit of this same conversation in the Corporations Committee. And I take a much more negative or concerned attitude about this. I do not think that the system will handle the needs that we have now and in the future. I think your future and the demands we have in Sedgwick County are going to get worse. We're not able to handle that unless we put I'll say a targeted task force. It has to have legislative input. The legislators aren't good for this. We'll introduce a few pieces of legislation, but you need a ongoing management or a not-for-profit group actively pulling the hospitals, the schools, the local cities and counties, and it's not just here, it's also for Larned, Osawatomie, but also the state, and try to develop a long-term plan and some money to get it done, because the legislature is only going to put peanuts there. You know, we haven't had this discussion, but, you know, I threw out the Kansas Health Foundation should be an active, vigorous partner in this with the state and other groups. And we should charge this group to develop a plan for, well, someone used the term the Menningers of the South, you know, like Topeka was, but develop that kind of an understanding that that's what we need here in Sedgwick County. And we draw people to Sedgwick County because of the reputation over a period of time, because we have an update state hospital, because we have other resources, both private and public. And, you know, I still believe that that has to happen. If it doesn't happen, we're going to have a series of other failures over the next several years.
Claudia, you mentioned you're in the recruiting process. I don't know how far along you are in that, or any themes coming out of that, or about pay or other ways to attract, because I mean, we're recruiting all the time too for physicians. We've had a little bit of luck at Osawatomie with one that was looking for a change of where they live, but that's one out of recruiting for the last 4 years that I'm aware of. So any themes coming out of your recruiting?
We're fairly early into that since she just tendered her 90-day. So I'll have to keep this group updated. I've not heard that pay is an issue, at least so far.
And Scott, I don't, if it's okay that I add to Henry's comments there, the Center of Excellence, Kansas Behavioral Center of Excellence, you know this, Scott, as well, has formed a 501c3, and I think there is a concerted effort to work at all levels of behavioral healthcare workforce. And so the infrastructure is in place to begin working on, and there will be, that group is currently working on, we are currently working on legislative asks. But we need to continue to have this dialogue across the community, because for all of us from the community-based service providers to the inpatient psychiatric, we're dealing with this issue. And I think there's a real desire to make sure that our community and eventually the state of Kansas is taken care of so that we can manage the workforce issues that are happening. So I appreciate those comments.
And we do have in the report at least one recommendation about the number of residencies, funding residency slots beyond what's available now. And I think that you know, that works for now, but it works really well if it's a sustainable funding stream, so that every year we're getting 2 new residents or 3 new residents into the psychiatry program. And that's whether it's here at KU Wichita or the medical center campus in Kansas City. I think that pipeline again, and then we're providing training opportunities for at ComCare, at local service providers, at Ascension Via Christi, at the state hospital eventually. You know, that gives people a good opportunity to see lots of different kinds of behavioral health, mental health practice, and hopefully we can figure out how to make that work then across the folks who want to teach or want to, you know, just practice or meet the needs of really acute people or work with kids only, or all those different options that we need to kind of meet all those streams at the same time.
I think Representative Helgerson's recommendation is actually spot on, because we're kind of parallel with the construction, that talent pipeline. That should be the number one thing that we're, you know, have going, because, you know, I just got an email from Dr. Greg Hand. Their LMHT program is just got approved. And so there's momentum, and we just need to look across and say, what are we going to collectively need, and get a plan around that, and maybe not focus on the fires just in front of us, but just keep that plan rolling.
We can certainly have the Center of Excellence folks come back. I mean, well, Mary's on that group. I'm an agency appointee on that group, so we can certainly do that. But it'd be good for their leadership to kind of hear, and I'll feed this back to them certainly, but have them report on their efforts too and what they're asking for. And again, I do think they're hitting a lot of the themes. whether it's a comprehensive strategy or an overall approach. It's having money to train students wherever they are into behavioral health and then have a job pipeline or career pipeline identified. Those are the right themes, but I don't know that's entirely hitting what Representative Helgerson's talking about with, how would we know we're making progress? We'll know if we get more students in these programs, but there may be other things we want to look at as well. It's got to be sustainable too. Other questions or comments? I guess for me, so this group is charged until March, I think, or our charge runs out in March. And that makes sense. We'll hopefully be in the construction process by then. We'll maybe be replaced in terms of the state hospital with another advisory group. But these workforce issues are going to continue, and we'll need to have a place to talk about that. The Center of Excellence is certainly a good place for that to happen. It's it's not a small group at all. It involves a lot of different people, but do need to think about how we draw the Sedgwick County, the community stakeholders into that discussion as well. That part, I think is present, but maybe we have a few voices that we still need to draw into that as well. Okay. Thanks, Claudio, for raising that. Wanted to talk just a little bit about the operating budget for the hospital. Again, this isn't anything that the panel needs to approve or act on necessarily. I just wanted to give you an idea of how this project fits into the state budget process. That's it happens throughout the year, but we're at a phase now where we've submitted our request to the governor's office for review. She'll combine that into her budget request that'll go to the legislature in January. So I mostly just wanted to share what we're thinking in terms of what the next couple of fiscal years look like. So sent around yesterday, just a one-page sheet that's pretty high level. And you will think that there's got to be a lot more on here to spend $80 million or so, but it's really not. It's pretty simple. We're going to spend money building a building and hiring a few people to work that are going to work there eventually. But so what this has is salaries expenditures at the top and the funding sources at the bottom part of the table. We really split our budget into kind of the operational parts, which are salaries and wages, contracts with other parties to pay rent or other vendors that help us with things, buying supplies, and then capital improvements is treated a little bit separately. So we've got both of those categories. So in 2025, that's our fiscal year that started in July of this year and will run until June of 2025. And then the second fiscal year that's in this budget window is fiscal 26 that starts next July. So the main parts of the fiscal 25 budget that probably makes more sense from the notes. So our plan as an agency is to fill a few positions that we think we don't think we know we need to help with the construction process. And while construction is happening, to build the policies, procedures, all the operating pieces that are going to need to be in place for the hospital to operate, and also think about what we need to have in place to set the stage for accrediting this hospital once we get it open. And that we think is going to take a little over a year or a year and a half, which is why we're starting that hiring process this year. Primarily for this year, number one is the superintendent role, which we've already done. So check that off the list that started in August. Our next hire is going to be a facilities director or project manager focused on the facility because I have 100% confidence in the Sedgwick County team here to oversee the construction part of the project and the building. But I kind of want to have our own person here as well, who is on the ground with the contractors and thinking about how we maintain this building, keep it running once it's turned over to us. So we want to get that position hired still this calendar year. Then we'd like to fill the chief clinical officer and an IT director type position sometime around the first of the year. The chief clinical officer in as we operate at Larned and Osawatomie, Doesn't have to be a physician necessarily, but is somebody who's got clinical experience in mental health treatment, can help develop the active treatment plans. So we're not going to take a psychiatrist out of the mix right away, at least right away with that role, but somebody to help, because Arena's not a clinician. I'm not a clinician. We can work with our teams at Osawatomie and Larned, but somebody who's really going to be focused on this building, what the treatment model is going to look like. All those are necessary for accreditation as well. And then the IT director, I think, as we're going through the design process and construction, there's a whole lot of systems in this building. And we need to have a state IT person looking at that while it's being built, designed, and then figure out how to operationalize it. So that $432,000 is the salary budget for those 4 positions over the course of this year. On the contractual services side, we've got our contract with Greenbush Learning Tree Institute, Falk Architects, which is our architectural consultant. And then the one that we haven't started yet, and I don't think we've talked to this group about, is the Joint Commission Resources. So the accrediting body for hospitals, the Joint Commission, JACO, has a consulting arm that helps hospitals and people building hospitals work through the accreditation process, starting they can start as early as when you're designing a building or coming up with ideas, all the way up until you actually get accredited and go through mock survey. So we're going to engage that group as well pretty soon, actually, within the next week or so, to help us with reviewing the plans, to make sure we've done the right things, review our staffing model, and then help us through the accreditation process as the building's underway as well. So that's in that contractual services line. And then the capital improvements number, the $76 million or so, is the construction, essentially the construction budget, the construction administration budget for Sedgwick County, all the contingencies around construction, everything is about the building project itself. That amount reflects money that's been appropriated in the past that hasn't been spent, that we're going to show as being spent this year. And then in 26, as that rolls forward, is the kind of closeout of the project, the remaining funding that's there. The couple of things that are missing or that don't show up on this budget, for I guess it's a good reason. See if I can explain it. Is the ARPA money, the $25 million in COVID relief money that's part of this project, that in our state accounting system shows as being spent last fiscal year. Because it's obligated to the project and it doesn't show up anywhere else in the budget. So we've essentially already spent that money. The county doesn't have it. It's still in a state account, but it is obligated to the project based on our agreements with Sedgwick County. So that doesn't show up on this. So the other thing I need to do is show you the total project cost as we move through it. That'll show that $25 million in ARPA money there as well. And then maybe the last comment I'd make about this report is it does show $175,000 in each fiscal year of ARPA money. That's what we're going to use to pay for that Joint Commission Resources contract. It's an allowable expense from ARPA, from the COVID relief dollars. And over the 2 years, it's about a $350,000 contract that we've been negotiating. So we think we'll just split that over two fiscal years. It doesn't impact the construction budget. It's not taken out of the construction budget. It's extra money in the ARPA account that we can use for this, because it helps with the building project and oversight of the building project. Let's see. Oh, that wasn't the last thing. Last thing. Fiscal 26. So all of the positions that I talked about for 25 would continue through that fiscal year. The other positions that we'd fill during, again, this is after next July, would be a chief medical officer psychiatrist. So that's when we're going to be in the same pool looking for a psychiatrist to be the chief medical officer for the new building, a director of nursing, a procurement manager, and then the human resources support. We don't think we need that now in terms of recruiting for the hospital, because we don't have a building when we can manage the hiring that we're going to do with our KDAD's resources. But by the time we get into next fiscal year and we're 6 months out from the building being ready, that's when we want to start thinking about recruiting more actively in terms of the other nursing, allied clinical, direct care, maintenance, those kinds of support services. We're going to need to ramp up the recruiting effort So we think that's a fiscal 26 timeframe kind of thing. But we do think, just like the clinical officer, for recruiting other physicians, other nurses, we need those leadership positions in those disciplines on board and part of the team here in Wichita on the ground to be part of that recruiting process. The great thing is they can also work in some of these other efforts around work pipeline training, recruiting for other providers. And they can be our representatives to those groups, and you don't have to hear from me and Arena and all those activities, which I think will be meaningful to the effort. So that's what our operating budget looks like over the next couple of years. This is what's in the governor's, what we've submitted in the governor's budget. It's not new money. It's money that's already been appropriated. The whole project's funded. So including the operating costs, at least for these 2 years. I don't anticipate any major questions about this. But there will be questions about it. So I wanted to make sure you all were aware. Any question, Representative Hudders?
First, you're going to have staffing coming on shortly. Where are you going to office them?
So our plan at the moment is to have people work from home, but I think all of these positions, we would primarily be looking for people in Sedgwick County or in this part of the state, not in Topeka, with the exception of Arena, who lives where she lives, and that'll work. But I think everybody else is going to be, their home base would be here in Sedgwick County. KDADS is in the process of moving our office. We have an office here for our survey team and some of our behavioral health staff. We're moving into a new building that's going to have some additional space, and I've asked for.
So you can house them there.
We're going to have a couple of offices there that will be available for some of these people. I don't know all of them, but.
The total cost for the project is, you said 77, 14, and 25. Is that right?
Yes.
77,
Yes.
14, and 25 for
Yes.
the construction and whatever other odds and ends that you have.
First part of operation.
Okay.
Yes.
It'll come up later, so I'll bring it up now. Is there any problem if we used ARPA funds rather than state general fund dollars for the 77 million? Does it cause the county any hardship?
No, I think the goal from the get-go was to use ARPA funds first, because there's a timeline on that. Now, if it's obligated, and Scott, we might go back and just revisit that again. If it's obligated and spent, and that's the goal here, right, is to spend that first.
Right.
Potentially, or not potentially, in this fiscal year.
Yes.
But we'd prefer it be spent first.
Well, is there any problem in your two minds if we just moved? We have interest from ARPA funds that's floating around, and some ARPA funds that have been committed or returned. And, rather than leaving them up for legislators to play some shenanigans with, or the governor, if we got them committed, if we did the transfer, gets it off of our books, the ARPA funds, and then we just deal with state general fund in our budget. But I wanted to know if it causes you two any heartburn. And you don't have to answer that, Scott.
I don't think it does. The two concerns, one's not very important. We've described in our MOU with the county, the funding sources, and we have that $25 million figure in it. So we'd have to change that. That's not a big deal to do. The other concern, just because of the time frame, I'm not quite sure what the payout schedule for the construction will be. We're going to, start in February, let's say, and there'll be some upfront costs that the general contractor will want to have and covered. And we kind of think the 25 million is going to be that initial ask, and we'll award that. I don't know how much cost that we'll expect to pay out between when we start construction and June 2025 we'll have. We've got to spend all the ARPA money by December 2026. So I think unless if you're giving us it's $100 million of ARPA, that might be hard to spend. If we're talking about another increment of 25, that's probably not a big deal. But I just want to make sure we have enough expenses to.
Well,
make it-
what I'd propose, if it's agreeable with you two, is I'll give Adam a call and say, Adam, why don't we move more ARPA funds in and get this used up? You get those funds used up. If he and the governor are comfortable with it,
Makes sense.
okay, all right.
Other questions about the budget Senator Reddy, I'm sorry.
Yeah, no, thank you. I think using ARPA funds for this makes sense to me. So maybe I'll mention it. How much is still there in ARPA funds? How much is
I
still
haven't seen a
available?
number, Senator, to know. We can.
I think the interest.
The interest?
It seems like the interest was $10 million a month that we were pulling in.
Okay,
So it was substantial amount of money that we were pulling in still. But I haven't looked at the total, but we can find that out pretty easy.
right. I just wanted to make sure there was enough as we approach it. And then it's appropriated so that Scott and KDADS and everybody receives it in a timely manner to fulfill the obligation. Yeah, I think that's a great idea. Good idea to look into. Thank you.
We have a pretty streamlined process. I mean, if people tell us we can spend it, we can figure out how to make that work. So I think, and that process works very well. We've got great support from the recovery office to make that work, but those are decisions others make and tell us about, and then we go figure out how to do it. Okay, that's the operating budget. I guess our last item is the final report draft. You've had the draft report for a while. You've had the recommendations as a separate document also for a while. So if there are what I thought we might do, just as a way to sort of focus attention, is our friends at Greenbush are going to share their screen. Bonnie, who's doing this, and we're going to kind of at least walk through the recommendations section and make sure that that's where we want it to be. The rest of the material, if there are things that you found, in particular, what we're looking for in the comments, most of the report describes the work that we've done and the testimony we've heard and results, things we've talked about. There's something in there that you think we missed or want to characterize a different way, that would be good to know. Other people that have contributed to the project, we have, I think it's a really comprehensive list, but we may have missed some people or spelled their names wrong. That would be great to get that edited in there as well. But so I think we'll focus on the recommendation section first. And that's up, it's on the screen. So, and this isn't the full language of the recommendation, but it's pretty close. So we talked about catchment area. And what we recommend is defining the catchment area as for the new hospital as Sedgwick, Butler, Cowley, Harvey, and Sumner counties. And I confirmed with Joan that Cowley was right, and I did another meeting and I got it had a totally wrong county. So I feel pretty good about that list. And in the formal recommendations, was Claudio's suggestion a few months ago was, that might be a good place to start, but we ought to really look at the data and figure out whether that's too big or not big enough, and kind of have some flexibility to build as we see what the admissions look like. So please speak up if you've got suggestions. I'm reading and trying to watch the screen, but then we have a few workforce development recommendations as well. 3 training, 3 psychiatric residency slots here in Wichita. Incentives to promote the pipeline, working with the Behavioral Health Center of Excellence. A system for student loan forgiveness. I'd rather have the word fund, establish a fund for student loan forgiveness, Bonnie, if that's okay. And grant programs for training programs. Expanding LMHT training programs and financial support for clinical placements in the next fiscal year. And then work with licensing authorities and community partners for alternative recruitment options. Questions or suggestions or anything we've left out of that one that we want to? I'm going to say something more specific about. I don't know that we can direct the Kansas Behavioral Health Center of Excellence to do anything, but work with them on a workforce strategy for how big of a area do we want to, or do we want to limit it to Sedgwick County, or let me start over. Work, I guess, I think good recommendations are directing somebody to do something with the appropriate people. So I guess we'd be saying KDADs should work with the Behavioral Health Center of Excellence to develop a workforce strategy for behavioral health and mental health professions. Then I'm stuck on, is it in Sedgwick County or is it in South Central Kansas or is it for the whole state? And I'm a little stuck there, but I got you like maybe halfway through. So if there are other suggestions to end that sentence, Senator Reddy, your hand's up, please.
Yes, I don't have an answer to your question, but I do see the challenge of everywhere we go, there's a need for staffing, especially for psychiatrists and such. So even if we have workforce development, KDAD suggests 3 slots, for state hospitals and all of that. So this is a plan specifically for this psychiatric hospital or for anything in the state of Kansas?
Our charge as a panel is to make recommendations related to the state psychiatric hospital here in Sedgwick County.
Okay.
Doesn't mean it's limited to that, but the charge is to focus on recommendations that certainly benefit the hospital that we're building. It does also talk about contributing or gathering information or making recommendations that improve the behavioral health workforce in this area where the psychiatric hospital is being built.
Okay. Yeah, I didn't know how specific we can be, especially when we're talking about a workforce development plan. But I suppose if that's our charge, we should be specific to it. I'm just a little apprehensive because I see this need throughout the entire state. But if we can make the language such that it is specific to this area, I guess that's necessary. And then we can worry about the rest of it later.
Mary, your hand's up too.
Yeah, I was just going to say, I almost would not want to limit it to something like Sedgwick County. If you're going to say South Central Kansas, maybe with respect to the workforce development, because that puts a barrier there, which I don't think is necessary and not probably the intention of the Behavioral Center of Excellence or this group. So I think a good recommendation is, like you're suggesting, that KDADs could work with the Center of Excellence in developing workforce pipeline, because again, the intention of that group is getting a model established that then can be replicated across the state.
That's a good way to get the statewide.
I'm glad Mary volunteered Center of Excellence. I 100% agree. It should be regional. Everything we do here is a regional approach, whether it's economic development or jobs or whatever. This would fit right in. And the fact is, if somebody is a psychiatrist in McPherson County, can they do something in this region? Absolutely, yes. So I think we definitely should keep that regional.
Maybe have that panel be expanded to include KU. on that task force.
Sure.
So Behavioral Health Center of Excellence and the KU School of Medicine.
They have, Mary help me, they have a board seat, maybe two, I think.
Yeah, sorry, I was a little delayed on my unmute there. Yes, they are represented on the board of the Kansas Behavioral Center of Excellence. And also have advisory council seats.
We'll take back that comment and we'll craft another recommendation and maybe send it around by email and see if that meets the needs rather than trying to wordsmith too much along the way, unless Monica or Bonnie or Ryan, you want to try to hammer it out right now.
I just have one comment. I want to confirm that the group's thought around this one. If I remember correctly, this focused on a variety of educational incentive programs. And by adding the Center of Excellence, are we narrowing that?
Well, the center has representatives from the independent and community and technical colleges as well.
Okay.
So I don't think it excludes them, but there may be some other, well, maybe there are some private nursing schools that maybe don't have seats necessarily, but we work with, I mean, at KDADS, we work with them. So I don't know that it would leave them out by focusing it around the Center of Excellence. The one, I mean, what we'll have to add in, I think, is the regional workforce center here in Sedgwick County or in the region. There's one in Sedgwick County, but there's regional ones as well. That'll be important because they'll have access to infrastructure that'll need to be part of this. Other hospitals, other physician groups that are in the area as well. So it'll have to be a broader group than just the Center of Excellence, but I think calling them out as a facilitator makes some sense. We'll work on the wordsmithing and email that around with the understanding that many of you, at least 7, will weigh in and say that it's okay to include in their report in the next 14 days. We'll keep scrolling through. There's some other legislative recommendations to the legislature or governor and legislature about statutory changes. We talked about asking the Criminal Justice Coordinating Council or Judicial Council to look at the Care and Treatment Act around just involuntary commitment. And again, as we're adding this hospital to the available options for involuntary treatment, are there other things we want to see in the statute that would be that need to be updated? The Department of Education has a human service training pathways, and we were recommending that they add a counseling or behavioral health pathway to the human services cluster. I can do a better job explaining that one if you've got questions, but I think we've talked about that one before. Privatization, where I think landed as a group, maybe not with consensus, but it may a majority was that the recommendation is that KDADS would operate this hospital as a state hospital with state employee leadership. We don't say as opposed to what, but I think that captures what the will of the panel was. Coordination with existing services, that we'd establish a formal intergovernmental agreement. I think there's a time frame actually in the longer version of the recommendation, but intergovernmental agreement among law enforcement, emergency services, fire, and regional behavioral health providers related to the new hospital. I think that was over the next year or so, and again, we'll have people on the ground who can do that. We wanted to provide a report on our agency efforts for programming for youth and behavioral health crisis. We didn't say that to who, if it's the longer version is the advisory panel requests that KDADs provide a report about agency efforts. So it's a report back to this group, which means we'd have to do it before March. Which those people don't work for me that have that information, but I think I can probably get them to give us a report on what we're doing around youth programming. And that'd be a good thing to share. It's a good suggestion. The KDAD should recommend increases in funding or new programs to address gaps in services for justice involved youth or youth in crisis. To enter a memorandum of agreement with the biomedical campus to identify clinical, educational, and research opportunities when the facility opens or before the facility opens. Again, that makes sense given other things we've talked about. From our last meeting, a couple of suggestions that came were to create a nonprofit foundation to support the mission of the regional psychiatric hospital. And we do have, for maybe those of you that weren't here last month, so I think it was Latasha mentioned that if there was a way for people that want to support the hospital outside their tax dollars, which definitely will go to this hospital, but they want to provide support. We do have private foundations at Parsons State Hospital, Larned. We're working on one for KNI as just a way for grants to be, we can either apply for grants that can come from different ways, or if people want to make a donation to support the staff. So anyway, just to have that in place as the building's opening. And then creating a citizens advisory group of community member service providers. Again, specifically say, let's have a way to get public input on the operations of the facility as it opens or when it opens. And then, oh, sorry, Representative Helgerson.
Privatization, where is that?
Page 2. And scroll back up to the privatization section. And then there's in one of the meetings that we talked to, or we had the presentations from national experts and Secretary Keck. And I reported that we'd briefed the governor, and her direction was to, this panel makes recommendations to the governor, but I did want you to know that we'd talked to her about privatization. She wasn't interested in that as a path, but we still gathered information and we stopped working on it, but this is where we ended as the recommendation from the panel. Yeah.
Is it agreeable that we have language that says, while we're not trying to privatize the hospital, certain elements such as laundry or food service, maybe even lawn care or landscaping may and should be looked at for privatization rather than handling it within house. I think that makes better sense.
Sure.
And that probably fits along with state policy in other areas.
The longer version of the recommendation was the state would be what it says there, and then the state should be responsible for all admission and discharge decisions and design of the therapeutic treatment model. KDADs and the hospital leadership could choose to contract for services needed at the hospital, such as food service, laundry, maintenance, supplemental staffing, or medical services. And then, so the last section of kind of budget items, let's see, from the education and workforce group, they had recommended that we ask for a review of telepsychiatry, reimbursement for telepsychiatry in the next fiscal year. And we're working on that some. That anyway, that was a request that was made, and then that we approve a budget enhancement. We should probably say include, I don't know why I missed this, Bonnie, before. I'm sorry. It should be include in the fiscal year 2026 budget an enhancement to increase funding for regional case management and behavioral health providers. That was another recommendation that came from the law enforcement group, I think. The law enforcement subgroup.
That's correct.
Any other thoughts about recommendations or other areas you'd like us to include? Bonnie, why don't you scroll down to the conclusion section, just let people put eyes on that here as a group. Says what we completed as tasks. Bonnie and the Greenbush team are great about documenting things that we did, which is not, I'm not great at taking credit or acknowledging that what we accomplished and always think about what the next thing is. So they did a good job of not just documenting, but calling out where the progress that we made. So I want to make sure you see that part. And then maybe go to the next page. So we just wanted to have an acknowledgement section of folks that contributed either as presenters or provided other testimony or came to the town halls. So again, if there's somebody that, as you look through that list that we obviously missed, it'd be great to get that added.
Scott, this is Yusha. I just wanted to say, I think, I mean, I think the draft is pretty good. But when the question about privatization on page 6, it did highlight where we did talk about it, and some of the aspects such as food and everything that you had mentioned, that it is in the draft as folks look at it in its entirety when it's presented.
Just in terms of names, I think if for Center of Excellence, having Kansas Behavioral Center of Excellence listed. And then on our organization name, because we have had a name change, I would ask that you move Association to America. Thank you.
Thank you.
I don't
Is that right?
think so.
Yes.
Okay, and then the other one was,
Fourth one down should be the Kansas Behavioral Health Center of Excellence. Center. Well, is it of or for? Of excellence, I think. Oh.
okay. Awesome.
Bonnie, I think you need the word health. Is that correct?
Yeah,
Kansas
behavioral health.
Behavioral Health Center of Kansas. No, you're right. You got it now. Thanks to Bonnie for letting us all be backseat drivers.
Oh, that's okay.
No, to your left, to your left.
And then acknowledgements, make sure I've spelled everybody's name correctly.
If you're here and you don't catch it, that's on you. Everybody else will check for it for them. But if you're, I think everything else is right. So the one thing that we'll add to this is the full list of recommendations that has more of the detail, but we'll attach that. We'll make a pass at writing an additional recommendation about working on a strategy for workforce recruitment in the region with the Behavioral Health Center of Excellence for you all to look at. And then we'll, I won't send you the whole, I don't think I'll send you the whole document again unless somebody really wants to see the whole thing before we finalize it, but I'll just send you that recommendation to look at and maybe put some voting buttons on the email and you can say whether that works or doesn't work. And then we'll complete the report, and I will send the final report out to you so you can take a look at it before we submit at the end of September, on September 30th. Any other thoughts or suggestions about final report? Okay, before we adjourn for today, I do think we're charged to meet every month through March. I think we have some things that we need to bring back, report from KDADS about youth services. So we'll do that after the first of the year. We'll have some things to talk about with the bidding process. I'm struggling a little bit to figure out what we would talk about or what we would meet to discuss in October. Or I'm sorry, in October, because we'll be either in the bidding process or the bid documents will just be released. So if we have a meeting in October, it may just be virtual, just as a touch base with project updates, unless there's something else that someone else on the panel would like to make sure we discuss, and we can certainly have a full meeting or schedule something. But I was thinking probably just meeting in November around the bid process, December around kind of the final decision on the general contractor, and have you weigh in on that. And then that's as far as my brain has gotten in any planning process. So we'll figure out January after that. But I was struggling to justify a meeting in October. Guess I'm looking for some permission, but
Virtual sounds good. Yeah.
but if something does come up, we can change. But I think, and I do think the Behavioral Center of Excellence, that may be a group to have come back, because they've got some other recommendations, and now that the board's been formed and there's an executive director or acting executive director, and I think there may be a few things that they have on their agenda that they'd like us to hear about, but that may be January as well. Okay. There isn't any other business to come before us today. Entertain a motion to adjourn. Representative Helgerson moved and Jason Gregory seconded. All those in favor say aye.
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 Any opposed? Hearing none, we're adjourned for today. Thank you very much for your work. Yep.